Miss Morgan. I'm your nurse Elizabeth today, and I'm going to be performing a physical exam if that's okay with you.
That's fine.
Okay, so I'm going to close the door for privacy. Can you let me see your armband and say your name and date of birth?
Kaylee Morgan, 1/22/2002.
So it matches your medical records, MAR, and medical record number is the same as well. So I'm going to come over here and perform hand hygiene. Okay, hand hygiene is done. And before we get started, I want to let you know that all of this is confidential and you have the right to refuse anything.
Okay.
Okay, so once we're getting started, I'm going to say your name. What's your name?
Kaylee Morgan.
Do you know where we're at?
At the Sim Lab.
Okay, do you know what day it is?
Wednesday.
So patient is awake, alert, and oriented ×3. Can you raise your right hand for me? So patient is able to follow verbal commands. Patient's grammar is appropriate for her age. So now we're going to get started with the exam. So first, I'm going to look at your pupils, okay? All right, I'm going to rate them a 6. Then I'm going to see your eyes are symmetrical, okay? And so then I'm going to dim the lights and look at your pupil response. So, okay. Turn the light back on. Can you look at this wall right here?
Mm-hmm.
And I'm going to put your pen right here. When I tell you to look at the pen, I'm going to test for your accommodation, okay? So you can look at the pen. Okay, so accommodation present. So patient is perla. The pupils are equal, round, responsive to light, and accommodate. So now we're going to go do the Snellen eye chart, if that's okay.
Yeah, that's fine.
Okay, we're going to walk out of the room. So I'm assessing your gait. Your gait is normal. I'm going to get you to stand 20 feet away, and I'm going to point at the line I would like you to read, okay? So first, can you do your left eye by covering your right eye? So can you read what I'm pointing to?
E F P T O Z L P E D P E C F D E D F C Z P. I can't read that one.
So patient has 20/20 vision in her left eye, and before I would ask her to do that, I would want her to keep her corrective lenses in. So now we're moving to her right eye, so cover your left eye, please. We're going to do the same thing.
E F P T O Z L P E D. I can't read that one.
Okay, so patient has 20/30 vision in her right eye. Now we're going to do both eyes, nothing covered.
E F P T O Z L P E D P E C F D. I can't read that one.
Okay, so patient has 20/20 vision in both eyes, both eyes. Okay, so now we're going to go back to the examination room. Okay, I'm going to close the door for privacy again. So that concludes our eye examination. So now we're going to move on to the ears. So the ears are symmetrical. They're aligned with the outer canthus of the eye. So I'm going to inspect them. Okay, so they're free of any lesions, drainage, redness. I do note that she has one piercing bilaterally in both ears. So now we're going to move on to your nose. Your nose is symmetrical. It's midline with the face. There's no lumps, lesions, or redness. There's a couple of freckles scattered throughout. Now I'm going to ask you to tilt your head back. I'm going to look inside your nose. Okay, so turbinates are present. Now I'm going to move on to your mouth. So would you mind opening your mouth for me? So the buccal mucosa and gums are soft, or they're pink and moist. I'm going to ask you to stick out your tongue. So tongue is midline, symmetrical. I'm going to look at your teeth, so your teeth are white, clear of any caries. I'm going to ask you to go ah and stick out your tongue. So the uvula arises with phonation. And can you let me look at the floor of your mouth? Just open. Okay, so the frenulum is midline. It's free of any lumps or lesions. So we're going to move on to your neck. Okay, so your neck is symmetrical. The skin characteristics, it has no lumps or lesions. It's appropriate skin color for her race. So now I'm going to look for any pulsations. So pulsations are present bilaterally on both sides of the neck. Now I'm going to palpate, which means your carotids. I'm just going to feel your carotids, if that's okay. So I'm going to do that for 15 seconds and then multiply by 4. So pulse is a 2+ on this side. Okay, pulse is a 2+ on that side as well, so pulse 2+ bilaterally. Now I'm going to auscultate your carotid. I'm just going to listen to them, okay? I'm going to do this with the bell of my stethoscope. And I'm going to ask my patient to hold your breath while I do this. Okay. Okay, no bruise present. So now we're going to move to the posterior part of your chest. Okay. So if you don't mind, I'm just going to ask you to lift up your shirt a little bit. Yeah, just right there. Okay, so the skin is free of any lumps or lesions. I do note freckles scattered throughout, no scars or anything. Now I'm going to just palpate for any tenderness. Okay. So let me know if any of this hurts or anything. Okay. Does any of that cause pain? So no tenderness noted. Now I'm going to auscultate for your breath sounds with the diaphragm. Okay, so breath sounds are present, they're clear and unlabored, and there's no adventitious sounds present. Okay, so now I'm going to percuss over your kidneys, if that's okay, the costovertebral angle. So I'm going to find your spine and your last rib. Okay, does any of that hurt?
No.
No? Okay, I'm going to do the same over here. Does that hurt? Mm-mm. So no tenderness or masses felt over the CVA angle. Okay, so I'm going to move to the front anterior part of her chest. I'm going to assess her skin. So like I said, there's no lumps or lesions. The skin has some freckles, and it is appropriate for her race. I'm going to inspect her respirations and count them for 15 seconds and multiply by 4. So respirations are 14, and now I'm going to listen to your lung sounds, if that's okay. Mm-hmm. So I'm going to do the same thing I did over there. I'm going to lift your shirt up if that's okay. I'm going to lift this part up. Okay, so respirations are clear on labored and there's no adventitious sounds noted. So now I'm going to move on to your heart sounds. I'm going to first start with my diaphragm. Okay. I'm going to listen over the aortic valve.
Okay.
Second intercostal space. Now the pulmonic. Okay, now I'm going to do tricuspid. Okay, now mitral. So S1 and S2 were present in all aortic valves. There was no murmurs or gallops heard. Now I'm going to do it with the bell. Okay, so S1 and S2 were heard over the aortic valves, and now no murmurs or gallops heard. Now I'm going to go ahead and do the apical pulse. So I'm going to ask my patient to lay down flat. So apical pulse, fifth intercostal space to the left. Do it with my diaphragm. Turn my bell back. So first I'm going to auscultate. For a minute. 15 seconds multiplied by 4. Okay, and now I'm going to palpate. (15 seconds by 4). So it was a 14. S1 and S2 were also heard. No murmurs or gallops present. Okay, so now I'm going to move on to the abdomen. First, I'm going to inspect the contour. So patient's abdomen is flat. Patient's abdomen is symmetrical. The skin is dry, intact, free of lesions. Now I'm going to the umbilicus is present, free of any hernias. Now I'm going to look for pulsations at eye level. So pulsation present. Now I'm going to auscultate her vowel sounds. I'm going to listen to all 4 quadrants, starting with the left lower. So normal active vowel sounds. Now I'm going to lightly palpate her bowels for any tenderness. Any tenderness? Okay. No.
Mm-mm.
So no tenderness or mass is felt. Now I'm going to do deep palpation.
Okay.
Tenderness.
Mm-mm. Nope.
Tenderness?
Nope.
No.
Mm-mm.
Okay. So no tenderness or mass is felt. And so I'm going to ask my patient to lean back up, and we're going to do upper extremities. So first I'm going to be testing the muscle strength of your hands. Okay, so can you grip my fingers like this bilaterally, or so both hands grip? Okay, good. Now can you put your hands like this and try to push my fingers out against the resistance? Okay, good. So 5 out of 5 hand strength. Now can you lean your arms up like this, and can you push against my resistance? Okay, can you pull? Okay. So 5 out of 5 muscle strength for her arms. Now you're gonna shrug your shoulders, and I'm gonna put some resistance down. So shrug, okay? So 5 out of 5 shoulder strength. Now I'm gonna look at your radial pulses. Okay, radial pulses are 2+ bilaterally. Brachial pulses. Okay, brachial pulses are 2+ bilaterally. Now I'm going to look at the capillary refill in your fingers. Okay, so I'm just going to pinch a little bit. Okay, so capillary refill was less than 3 seconds in all 10 fingers. Okay, so now we're going to move on to range of motion. So can you kind of wave at me like this? Okay, can you flex your finger or expand your fingers? Okay, so full range of motion in the fingers. Can you move your wrist up and down like this? Okay, can you go in and out? Okay, so full range of motion in the wrist. And now we're going to move to your elbows. So just flex and extend. Okay, so full range of motion in the elbows. Now I'm going to have to ask you to stand up for this part. Can you just follow my lead? So flexion, extension, abduction. So you're going to put your arms up, adduction back to you, internal rotation, okay, external rotation. Okay, great. So full range of motion in her shoulders. Okay, now before moving on to your lower extremity examination, I'm going to go back and grade your tonsils. Do you have tonsils?
Yes.
Okay, do you mind if I do that? Okay, I'm going to grade them a 2. And then, can I test your gag reflex today?
No.
Okay, so patient deferred, but if I were to test it, I would get a tongue blade, put it as far back on the tongue as I could, and note if gag reflex was present or not. Then moving on, do you mind if I inspect or test your femoral pulse today? So, patient deferred, but if I were to do it, it is the pulse inside the groin area, and I would grade it. Okay, so moving on to your lower extremities. I'm going to inspect your skin, so normal or appropriate coloration for her race, free of any lesions, lumps, swelling. The skin is dry and intact. I'm going to look for varicose veins. So I'm going to look at the back of your leg if that's okay. Okay, look at the front. Okay, so no varicose veins present. Hair distribution, she has no hair due to her shaving her legs. Now I'm going to test the temperature of your legs with the back of my hand. Okay, so temperature of the legs are warm. Now I'm going to see if she has any swelling or edema. Okay, immediate rebound, so 0 for edema. Now I'm going to start the muscle test for your legs. So could you push against my resistance? Okay, push against, okay. Now try to pull. Okay, great. So leg muscle strength is 5 out of 5. Now I'm going to get you to do your feet. So just put your feet in the palm of my hands and just try to push against. Okay, now try to push up. Okay, so muscle strength in feet is 5 out of 5. I'm going to go ahead and inspect the toes. Can you just spread your toes for me? Okay, I'm going to look at the bottom of your foot if that's okay. And this foot. So skin is intact. No lumps or lesions or swelling. In between toes, there's no swelling, lumps, or lesions. So now we're going to do range of motion. Actually, first we're going to do your pulses.
Okay.
So I'm going to do your popliteal pulse bilaterally. So it's just behind your knees right here. So your pulse would be a 2+. Now I'm going to do the posterior tibial on your right leg. Okay, now on this side. Okay, so posterior tibial pulses are 2+. So dorsalis pedis on both feet. Okay, 2+. Bilaterally. 2+ bilaterally for all your lower extremity pulses. So now we're going to do range of motion. So I will ask that you lay back and we're going to start with your hips.
Okay.
So can you just pull your leg up like this, okay? Flexion, extension, both legs please, okay? And so can you just put your legs out one at a time and over, back over. Okay, so abduction and adduction present. Would you mind just lifting your leg up and turning it inward, okay? Okay. Okay. So inversion, eversion present. Okay, so now you can sit back up on the side of the bed if you would like. So can you just curl up your foot? Or you can stand up if this is more comfortable for you. So just bend your leg, flex it, extend it. Okay, both legs. So full range of motion in the knees and the hips. So now I'm going to ask you to plant your foot, point it down, and then pull it up. So full range of motion. Can you invert it? Turn it out and in both feet. Okay. Okay, so full range of motion in the ankles. Now, if this is more comfortable, I'll just ask you to wiggle your toes for me. Okay, so full range of motion in the toes. Now we're going to move to your spinal range of motion. So just follow after my lead, okay? So you're going to lean forward, lean as far back as you can, and then side to side. Okay, so full spinal range of motion. And now we're going to test for scoliosis. So would you mind just turning around for me? Okay, you're going to bend over and just try to touch your toes. Okay, so I'm going to ask if I can pull up your shirt if that's okay. Fine. Okay, so spinal is midline, the hips are symmetric, and the ribs are symmetric. So you are negative for scoliosis. And I'm going to ask you to sit back down. And while I was doing your spinal range of motion test, I noted that you have a tattoo on your upper left arm. And then I'm going to do the capillary refill on your toes. Okay. So I'm just going to do the same thing I did for your fingers. So push each. So capillary refill is present within 3 seconds on each toe. So I think that is the end of our examination. So do you have any questions or any concerns or anything?
I don't.
Okay, so great. Thank you for letting me examine you today.